My specialty is in orthopedic surgery with subspecialty in hand surgery. And it's a lot of fun to be a hand surgeon. First of all, I get to operate sitting down. So being a hand surgeon, I get to do a little bit of plastic surgery, some orthopedic surgery doing bone work. I get to be a neurosurgeon and work on nerves. I get to be a vascular surgeon and work on blood vessels. And I get to also be a microvascular surgeon, meaning that I get to do the neurosurgery nerve work. I can take care of every problem within the hand. The interesting things about hand surgery is that now we're able to do things minimally invasive to shorten the recovery period or also have less pain and also to get better outcome. I feel like patients these days want to get better yesterday and they'll do anything they can to have a shorter recovery period or even and also a better recovery and a better result at the same time. Pain from hand arthritis has become more prevalent now more than ever because everything we interface with in society involves some type of an input, such as using your microwave or using a computer, and it seems like everything involves pushing a button. And arthritis basically is your joints wearing out. I find that as a challenge to be able to make people's lives better by helping them cope with the arthritic pain, whether it be surgery, injections, or braces, or even therapy. Well, carpal tunnel syndrome is probably the most common problem that I see in my office. Carpal tunnel syndrome is basically nothing more than a pinched nerve. A lot of structures have to go through a very narrow passage, and in doing that, the nerve is the most vulnerable structure in there, and the nerve gets pinched. Unfortunately, carpal tunnel cannot be prevented. Studies have shown that carpal tunnel syndrome is not caused by repetitive use. If you do have carpal tunnel syndrome, repetitive use can make your symptoms worse. When you first get the symptoms, wearing braces at night allows your wrist to be in a better position so the symptoms are better at night. Sometimes cortisone injections can help with the symptoms. And the last treatment would be surgery, where you physically make the tunnel bigger. So there's more room for the nerves and the tendons that go through that carpal area. And one of the nice things about the Centennial Medical Plaza and the Medical Center of Aurora is that since about 2001, I've been doing endoscopic carpal tunnel surgery, which is a surgery to relieve the pressure on the nerve by making the tunnel bigger. People have a quicker recovery. I usually find that my patients are able to sleep better within 2 or 3 days after surgery. And most people who do clerical type work, they're back at work going half to 3/4 speed, basically recovering over the weekend. People get back to work a lot sooner and back to activities sooner. I'd like to take patients who are otherwise healthy that have a problem and enhance their life. I find it very rewarding.